How's things been since the BBC?
Good. So exciting. University of Minnesota finally officially partnered with us. So we have two
Oh, awesome.
universities, both are in top five in the U.S. Cornell and Minnesota have partnered. So,
So what does that mean?
well, the cool thing about that is it's academia. So their standards are incredibly high. They care about the reputation. So who they partner with is very important, especially since we're handling their patients. So it's really, really important on their end as far as how they look, because they're the cream of the crop. They're academia, right?
Yeah.
They pump out the vets. Then it also shows progressiveness in terms of having hopefully more talks, more lectures, maybe even like curriculum for telemedicine,
Mhm.
because that's what's needed. And there are some
Yeah.
schools, well, there's one school I know that's doing it, the University of I think Texas A&M is doing that. They've been doing that for a little bit. But we need more schools to teach their vet students on telemedicine. So it shows progress in that direction. It's interesting that they've adopted teletriage with my company first before having a curriculum. I guess I should say I don't know for sure if they don't have a curriculum or not. I assume they don't because I've scanned their website and I haven't seen anything, but I could be missing it. I don't know. Maybe it's more internal. But anyway, it just shows the
So
need of
because
it.
like aren't generally like patients at the hospital more like at the university level? Aren't they more like specialty cases, like unique cases?
They
So how does that work? Like
most
after obviously the university's closed, and they're like, we'll call these dudes.
most universities have ER, so 24/7 emergency room, and then they'll have
Oh,
specialty, and some of them will have even a general practitioner part of it because you need vet students to be familiar with all those facets. So they're
yeah.
gonna have all different departments depending on what the client needs. That being said, it's a known fact with academia that their prices are going to be lower, but they're going to have students in charge of cases, and the cases are going to be generally speaking on a slower speed. So it's not like they're competing with their surrounding general practitioners. They have to teach their
Right.
students, but they're not pumping out cases like you would in private practice or a privately owned practice. So for us, for our purposes, they can use us however they want. They're using us mostly for emergency. If their wait times are starting to creep up for their emergency department,
Oh, gotcha.
then they're
That's
like, look,
cool.
it's six
Awesome.
hours for us. So you either can wait 6 hours or contact vet triage, and they'll tell you if it's worth the wait or not. You know,
Oh, that's awesome.
yeah, yeah.
That's cool. Hey, Kelly, how are you?
Good, thank you.
Kelly, meet Shadi. Shadi, meet Kelly.
Hi.
Two
Shadi.
two amazing people in
Nice to meet you.
the same Zoom call. Yeah.
Awesome. Well, thanks for being here. Sorry it took so long to make it happen, but we're here. So we'll have a great conversation with
Sure.
whoever shows up today. Maybe Megan I don't know if you have the link to the room that you could just pop in Slack and say, come join us in 10 minutes, just to get as many people to come as possible. I will have mute my camera off because the show is all about you two, not me. So
Well, not about me. It's about that guy.
I'm actually not Megan. I'm covering for Megan.
Oh, sorry.
No, that's okay. I'm Olivia.
Hi, Olivia.
So what's going to happen is once we start the session, I made Shadi and Clint both co-hosts. So then they'll be able to share their screens. Shadi, are you presenting?
I don't have any slides, if that's what you mean.
No slides.
well, then
This is a more
that's
free-form conversation.
even easier. So then you'll just have access to your camera, but anyone else that joins, like you won't be able to see them or hear them. But yeah, and then once at 4, I'll start it, and then it will automatically start recording.
Sweet.
Very cool. Thanks, Olivia.
Yeah, you're welcome.
So what's Ari been up to? Is he still working another job too, or?
Grinding away, man. That guy wears so many hats. He spends most of his time in vet triage. That's probably 80% of his time is that, and but he's busy as can be. So we're both
Gotcha.
hustling 24/7, trying to get this company off the ground. Well, we are off the ground now. It's more we just need to We need more. We want to help more facilities, more pet parents, more rural areas, increase access to care. We need more. I mean, there's if you imagine the number of phone calls that come through any given veterinary hospital on a 24-hour basis, and then how many vet hospitals are in the U.S. and then the world. I mean, there's so much more to be had in terms of helping pet parents with access to care.
Yeah.
Yeah. The numbers are staggering.
So who are your biggest competitors right now? Do you even have any?
So so there's two ways to look at it. One way is we don't have competitors because they're not even close to what we do, right? I mean, nobody else has 24-hour coverage, 7 days a week, any species, only doctors on board, all video, and then we create the individual relationships with each practice, however they want us to operate, so that we can look like an extension of them, which is what clients want, right? So no one does that. That being said, there are some companies out there that are well known in the telemedicine field, but they're not in the same ballpark. They're doing like texting or email or phone calls. Some have now started going into video. They're copying us in a lot of ways now. They've changed their price points to mimic us too. So they're starting to copy us, but no one does it the way we do it still. And then every time they copy us, I mean, they're 6 months behind. We've done that, and we're moving on to the next thing. So
yeah,
we've got plans for the next 12 months that are going to help expand access to care.
Awesome, man. That's awesome. Actually, that leads me to another fascinating question I'd love to talk to you about, and I'll tease you a little bit. Is also like by decentralizing the workforce, does it open up opportunity? Let me preface with this. Have you seen that terrible article that Bloomberg just put out today or yesterday?
Mm-mm.
So it was like inflation hits people who make under $300,000 a year hardest, and it was like, here are suggestions, right? And it was like, one, try eating lentils instead of meat. And as somebody who's a vegetarian, I'm like, okay, I totally embrace that concept, But I'm like, okay, that seems a little ridiculous. And then the other one was like, well, if your dog has cancer, like maybe consider like not getting them treatment. And it was like your vet care is like really expensive, right? So maybe consider not taking care of your pet. And I was like, you got to be kidding me! Like this is ridiculous. And then they had a whole host of other things. It was just terrible. But where I'm going with this thought is, man, I would love to also hear you talk about this idea of how can telemedicine help those who like these underserved communities where we know these pet populations are growing, but the typical six exam room, 10 doctor practice, that we see in a lot of these nice suburbs, they can't afford the services there. How does this maybe feed into?
Yeah, that's easy. I mean, that's an easy one. If you want me to answer now, or I'm going to wait for us to.
No, wait later. Yeah, but
okay.
Don't forget. I think that's a great. That's a great topic.
With the
underserved communities.
With the inflation comment and not treating your pet, because how much of being disenfranchised, let's say, is related to mental health. And then if you look at the positive influence that pets have on mental health, and you tell somebody, hey, change your nutrition and don't take care of non-human family members, how much of that is important for your mental health? And I would argue it's probably very important, I mean, we already skirt on our nutrition with fast food and stuff like that. You can eat cheaper and healthier, and avoid fast food. And that, of course, will relate to, more energy, better sleep habits, better health overall, right? And then we all know the positive influence that pets have on you, on your mental health. So it's crazy to say that, because if everybody was elevated just from a mental health standpoint, everybody got rid of anxiety and depression and all that, suicide, you get rid of all that. Can you imagine how much more productive we'd all be in our professional and personal?
Oh, yeah.
I mean, what the hell, man?
Yeah,
what
exactly.
kind of comment is that? It's so bizarre.
Yeah, exactly. Yeah, it's so wild, right?
And that's just from a mental health. I mean, you could argue lots of reasons why, killing your pets because they have cancer because of finances is a bad argument to make. I mean, it's not for everybody.
Yeah.
I mean, surgery, chemo, radiation, and seeing multiple specialists and dealing with the complications and all that to gain whatever number of days, weeks, months, or years you can for your pet with cancer, that's not an easy decision to make. You have to balance that with your own with your own personal beliefs, your own family, your own professional situation, financial. But boy, to say just a blanket statement like that's a bit odd.
Yeah, it was terrible. Part of me like wanted to post it on LinkedIn just to see what like the vet community had to say about that. You know,
are you able to?
I'll find it. It's a Bloomberg article. What I think is interesting about it, and the response that I would expect to get from the veterinary community, is not like, "Hey, we're worried about money coming out of our pockets." It's more of like, "What the hell, man?" Like, I think empathy for the pet itself not getting care, right? Like that would be like as somebody who's been in the industry a while, like that's the response I would expect. Not necessarily like a bunch of people worried like, well, no, like we got to keep the lights on too, you know, like get these treatments, you know.
It's funny you say that. So I had a meeting maybe a couple weeks ago with a group who's starting this like brand new idea. I won't spoil their concept, but at the end of the conversation, they're like, you know how you're talking to a veterinarian because you guys didn't ask for kickbacks. And I started laughing because kickbacks didn't even come to mind. I'm like, I'm not thinking, how can I benefit from this? I'm thinking, how can we increase access to care? And he's like, it's so funny talking to a vet versus like a non-vet because you're not worried about your own bottom line, you know? And so I was like, oh, that's kind of that's funny and sad.
All right, I found it. I'll put it in the chat here.
Cool.
So we can...
Thank you. Yeah, let me look at that. I'd like to see the exact wording on that and the context. You know, that stuff matters. But, boy, if that's what's said, that's a bit...
That's sad, right?
Weird.
Yeah.
If you want to cut corners financially, like, I'm sure there are many other ways. Like, how about drinking habits and cigarettes and, you know?
Yeah, exactly.
So many other things you can do to save money.
Gentlemen.
Sorry, yes.
We're going to start the webinar.
Alrighty.
Sorry, I'm on mute. Okay, I'm going to start it right now, and then it'll be in your hands.
Yeah, we'll start it. We don't need to totally record it yet, but how can we see? Okay, we can see how many participants come in.
Yeah, so once I start it, you'll just see like the number increase.
Okay.
All right. Are you ready to kick it off? I'll kick this thing off.
Yeah, I'm ready whenever.
Let's give it a few minutes because people are coming in as they cycle in through the waiting room.
Alrighty. Oh, gotcha.
I don't know.
This is why we need Kelly to keep us in line here.
Right? Like, I love enthusiasm, but let's get going, right?
Let's round it back a little bit. Bring it back.
Bring it back. Pull it back. Just give a minute.
Yeah.
Hi, everybody. You can tell we're a little squirrely today, but it's good. It's all good.
It's a Tuesday.
For a Tuesday, which feels like Monday/Friday. I mean, what day really is it? That's the bigger question, right?
This is true.
In which month, in which year? I don't know. That's always up for grabs, right? Okay, yes. It looks like our participant list just kind of like settled down a little bit. So first of all, I'm just going to say thank you to everybody coming from the technology committee kind of hosted this, but it was really Clint who arranged all this. So a big hand of applause of like, yay, Clint for pulling this on. The tech committee supports you. We're here and got your back. So I'm going to mute myself and stop my video. And then Clint's going to do the honors of introducing our guests. And also how you guys want it to flow. Like, do you want people, because we can't see you raise your hand. The only thing that we can see, everybody who's listening, is if you type in the chat box. So please find your chat box. We would prefer that than probably Q&A, right, Clint? I like always just looking at one spot versus multiple spots. And we're a chatty bunch anyway for Vet Partners. So if you can put your Q&A and your questions or just your hi in the chat box, then like I said, I'm going to bow out. Clint Clinton here is going to kind of take the reins, whether he's excited about it or not.
Oh,
So,
I'm excited. I'm ready.
are you excited? You're
Yes,
pumped?
of course,
Okay,
yeah.
all
You
right.
get to talk to this guy? Are you kidding me? Yeah, I'm excited.
I had to slow you guys down just to say we got to start the webinar, guys, right?
Yeah.
All right, so I'm out. Here you go, Clint. Give introductions.
All right. Well, thank you everybody for coming. I'm super excited.
Recording in progress.
All right, I had to wait for the recording to start. I'm super for this. One of my most favorite people in VetMed, Dr. Shadi Rafij. I personally have to tell you, like, when my dogs, especially towards the end, like as they had, they both actually had cancer, and unfortunately for this guy, but benefit to me, I had his cell phone number, and he was so helpful in so many situations. And so I'm really excited to talk about this idea of what kind of decentralizing the vet hospital looks like. This topic came about because some hospitals that we work with actually during the pandemic had shifted CSRs to home, and they've had vet techs working from home doing callbacks, some doctors working from home, and we kind of saw this decentralization of it. And somebody who's at the forefront of this, working with some top universities now, I just found out, which is like super exciting, so maybe we can talk about that a little bit. But what does this look like? How do we even start to embrace this kind of decentralized model, which I think has offered a lot of work-life benefits, right, for a lot of people. And there's actually somebody from the AVMA posted an article the other day talking about the vet tech crisis, right? So I think this also potentially gives us an opportunity to address that, right? Because most vet techs are only in the industry for about 4 years. And this whole article is about the massive shortage, not only that we currently have, but that we can experience in the future. So with that being said, what we'd like to talk about, what makes this man so amazing and so special, is that he's the founder of VetTriage. Not only is he a practicing DVM and a board certified surgeon, he's really, really, really passionate about driving, technology and pet health kind of into the future. So with that, Shadi, I would like to open this first question to get to know you a little bit. As somebody who is practicing in a hospital, board certified surgeon, how the heck did you land founding a teletriage company?
Well, thank you, Clint. I mean, you Clint and I met way back when VetTriage was still a tiny baby, and he educated me on the importance of cybersecurity, which I had no idea was even a thing in the vet space. And then looking into it more and getting data from him, I thought, my goodness, there's been some huge hits from the cybersecurity part of the vet field. So thank you for all the work that you do, my friend. Absolutely. So I had thought years ago, I have spent most of my career in large 24/7 emergency specialty hospital operations. And so these are large facilities that will house 100 to 200 people, and it's around the clock. And I noticed, this is probably going on 10 years ago now, that we had a ton of phone calls coming through. I mean, you can imagine 100 calls plus every 24 hours coming through with people asking the question, do I have an emergency or not? Should I come in or not? And in the vet world, our answer has always been the same. If you're concerned, come in. So I thought, boy, what if you took those calls and found a way to answer that question with an actual veterinarian? And so we started working on VetTriage about 7-8 years ago with this concept. I was still heavily invested in surgery. I perform orthopedic, neuro, and soft tissue surgery, all kinds of species, mostly dogs and cats. And this idea was kind of growing over time. And then it got to the point where it got fairly serious. We decided to launch the end of 2019. Me not being a big tech person at all, but I knew there was a need for this. And this is pre-pandemic. Then the pandemic hits, and of course the need for telemedicine becomes obvious, and pet adoption skyrocket. And then vet access to care plummets, especially in rural areas, which have always had a hard time, but even in major cities. And so there was no better time, unbeknownst to me, that VetTriage should be launched. And so that's how I got into it. It started with an observation, and then a business plan created, worked on the legal aspect, worked on the technology side with my dev team, and then launched. And here we are.
So let's talk about that. There's a couple of things you said there that I think would be interesting to dig in. And of course, if anybody has anything they'd like to ask, jump in the chat. Hopefully helping you learn stuff. And so if you have questions, please let us know so that we know we're on the right track, kind of providing you information that's valuable. The first thing that you said there was this idea of like, there's so many calls coming in. And then you kind of mentioned this idea of the pandemic and then this restricted access to care. What was crazy is for a lot of hospitals, we saw from the technology side, like their phone call volume was higher than a lot of like actual call centers, right? Like car rental call center or something like that. I mean, massive amounts of phone calls. And then you're right, like, you know, we saw this, like, there's this massive demand of people still wanting to take care of their pets. I think it's kind of up in the air, this idea that there were more pets that were adopted or got, you know, pandemic puppies, as a lot of people talk about them. I've heard some articles of some people saying yes and some people saying no. So let's just talk about this idea where if you, this like kind of call center problem, how can we think differently, especially about reducing that load on the receptionist that's so insanely busy at the front there? How can we think differently about kind of reducing that call load, but also providing people the answers that they need?
So I hate to sound like I'm selling my own product with that type of answer, but the major way to manage that type of incoming calls is by deferring them to another expert in the field, right? So that's what Vet Triage does. If you're finding yourself inundated with phone calls, your day is packed, your veterinary staff is at capacity, then you send them over to a qualified expert in the field, so another veterinarian theoretically, but that's not in your practice. And that's what Vet Triage does, 24/7, video only, veterinarians giving advice all the time regarding, do you have an emergency or not? If you do, we'll find you in an ER. If you don't have an emergency, how can we palliate the situation until your vet can see you again for a more controlled appointment, right? What can you do to band-aid this at home until, and then of course there's education that comes along with that, blogs, videos, there's more to it. That being said, if you try to figure out a way to hire more staff to handle those phone calls, then that's part of this whole conversation of decentralizing the vet world and allowing for remote work. Well, then you will see an increase in hiring. You'll see less turnover, better retention. And so the only other way other than diverting those calls to a company like mine is increasing your staff and retaining your staff, keeping them happy. Well, that ties into a positive work culture, right? And so although I believe that telemedicine is one way to improve work culture in the vet field, there are many, many things that need to be done that can be done in the actual veterinary community, the vet clinics, the vet hospitals, to improve their quality of life, improving their culture. So I think that's another way that you can manage these high volume calls as opposed to diverting them away from the clinic.
So, okay, so playing devil's advocate here, like if I was a hospital owner, right? I'm like, well, I have to get my hands on the patient, right? Like I need my associates in the hospital doing their callbacks. I need my receptionist at the front taking all of these calls. You know, if I'm playing devil's advocate, like how is it beneficial to me as a practice owner to think about either like leveraging a service or actually allowing kind of this remote work from home, better work balance piece? Like what benefits does that bring me? Like, are there any examples from hospitals that you can talk about now where we've seen an actual positive benefit?
Yeah, for sure. So if you look at a hospital, let's take the most obvious example. You're a fairly busy general practitioner. There are no emergency hospitals in your area. You're in a remote region, and you have to do your own after hours on call because there's no emergency hospital after hours. And you have a cell phone or your pager, as it used to be, and you're getting phone calls coming through from pet parents who are concerned after hours. Well, those concerns could be anything from very, very non-consequential to really severe. 81%, 82% are the non-consequential category. So very uncommonly, these calls are severe, right? They require you to be woken up at 3 a.m. to deal with it. But the calls are still coming through and you have to wake up to answer them. Then you still have the next workday full of appointments and surgeries. So if you look at the standpoint of get those phone calls over to another company so that they can triage them for you, sift through them, and then you as a doctor only get woken up for true emergencies, well, your quality of life right there goes up. Then the veterinarian can come in the next day actually rested and ready to attack a very busy and demanding day with surgeries and appointments, sick animals, euthanasias, the whole thing, right? So just that standpoint alone. We've received Christmas cards and Thanksgiving cards from hospitals that utilize our services thanking us because they finally got to spend the holiday with their families uninterrupted. And they were busy. They had calls coming through, but they didn't know that because they were coming to us. And we were helping the patient figure things out, the client figure things out, and there weren't any real emergency that weren't interrupting their Thanksgiving dinner with their family, right? So that's a very easy example of how quality of life improves. If the quality of life of the veterinarian improves, they're happier in the workplace, and they are usually in a managerial position. Well, that's going to create a happier work environment for the rest of the staff, the veterinary technicians, the receptionists, the vet assistants, etc. So that's a very obvious example of that. We have a huge problem in the vet field that's been brewing for at least 2 decades now, where the work culture has been largely toxic. It's been negative, and everybody's to blame for it. Clients that are unrealistic, to managers who are probably poor managers, to a disjointed team, gossip, turnover, not showing up to work, all the things, right? Being overworked. And so to answer your question more directly, it really involves a focus shifting from how do I handle this caseload to how do I make my team healthier, mentally healthier, emotionally healthier, so they can work in a positive environment, love their job, but still get basic things like lunch breaks and getting to leave on time. That's where the solution lies. My company is a very good deterrent for all this, but it's not the only answer. You have to work internally. Yeah.
So that's a great question. And so I think, like, let's say I'm a hospital owner, and like there's so many vets that I talk to that there's actually one that a lot of people know, Joy Furman. She was working. She's back in the hospital, and we were talking about what her next steps are going to be. And she talked about this idea of like really enjoying like being in the hospital 3 days a week. And I've heard this kind of like 3 days a week kind of thing come up quite a bit. Like it's really, for a lot of doctors, there's like this fulfillment of actually practicing at least 3 days a week. So if we have an associate, how can I leverage this idea of having them actually taking appointments 3 days a week, but then also leverage their expertise, maybe again remotely, 2 other days a week?
Yeah, so I was born in 1980, and so I'm right at that cusp there of, I guess, what, Gen X and Millennial, right there. And so I was trained kind of the way the old school was. You work your butt off, and that's what you do as a veterinarian. That just comes standard with it, and that's the end of it. And there was no talk of quality of life, of balancing, the personal and professional. There just wasn't. We were trained that way. And then a new generation comes through, right? And we all know the whole millennial in the workplace type thing. And they came in with this idea of, hey, I want to have like a normal life. I don't want to work all the time. And then that went right into the vet field. And you went from full-time in the vet field, specifically with veterinarians, being 40 plus hours to now 30, 32. So sub 40 as being full-time in the eyes of the vet field, these contracts that we're coming out with. And so that mentality changed the way we hired, and rather forcibly, because if you talk to any old school vet, they're going to think, they don't work as hard as we used to, right? Sure, maybe, but mental health is important, and we're seeing suicide rates on average in the vet field higher than the general public. We're seeing turnover rates and burnout rates that are higher than other medical fields. So we need to fix something, right? So is it really laziness, or we just need to now focus our energy on working smarter and not harder? So that brings up to this conversation. So that's where, well, that's where a lot of the focus has to lie now, is working on mental health from that aspect. So the hybrid model, where you have a veterinarian, let's say they're on the floor in the brick and mortar 3 days a week, and maybe they spend a half to a full work day off-site remotely performing telemedicine, right? That's already becoming a thing. There's already talk of this. And I've been talking about a hybrid model for a while now, where you fully integrate telemedicine with an urgent care center for that sole purpose. How can you have cases come through the door that need to be seen, but also have a quick turnover of those cases, because they're fairly simple cases, let's say, but the more complex ones get time invested. The ones that don't even need to enter the doors, keep them out. The pet parents don't want to be there if they don't have to. The pet doesn't want to be there if they don't have to. And your veterinarians and your vet techs and your receptionists want to work from home if they can. So there's a way to do this in a more global fashion, and that's sort of behind the scenes what's happening now. But to your point, yeah, you could have a doctor that works 3.5 to 4 days a week. 3 of those days are brick and mortar in person, the other half to full day at home doing telemedicine, performing telemedicine, and you still have days off. More than my generation of vets ever had. So it can be done that way.
That makes me, so So it makes me think about a potential challenge, right? Like what sort of skill set would an associate have to learn? So say I got this an associate who's open to this idea, and me as a hospital owner, I'm like, I think this might be a good way we can allow you to not have to worry about childcare because you can have, the kid at home or whatever, or you can just be at home and not be in the hospital 70 hours a week. What are some challenges that you see in this, like an associate getting started may come up against when learning to practice medicine virtually?
So I interview and hire all of my veterinarians myself. Since I've operated in GPs, general practice, I've operated out of rescue organizations, specialty ER. I've trained interns and residents, and so I have a fairly good grasp of the vet community as a whole. So I know what I'm looking for. So I can tell you, if I consider vet triage the cream of the crop, which frankly it is, I hire veterinarians based on those credentials, right? So you need a veterinarian who has enough experience in the field. That's number one. It's pattern recognition at the end of the day. That's what medicine tends to be. You've seen the same thing, the same type of case over and over and over and over again. 90% of your diagnosis is going to be based on talking to the pet parent and then somewhat on the physical exam, but really just the history alone, talking to the pet parent, you already have a good idea. The other 10%, you're performing tests to confirm or not what you already thought was going to be the case, right? That's your experienced clinician. So now if you translate that to the virtual world, well, now you don't have these anymore. You have to rely on the pet parent's hands in order to do what you would do in practice as a physical, which will not be as thorough, but is better than nothing. Better than a phone call, better than an email or a text message. So you have to have seen and heard these cases time and time again in brick and mortar in order to be familiar with pattern recognition, so that where on a virtual call, you're able to say with reasonable confidence, is it an emergency or not? And if it's not an emergency or it is, what do I think is going on most likely? And then what are some other possibilities to kind of keep yourself honest? So that's what you would need. You need to have seen the same case over and over and over again. That's not to say that every veterinarian has to be a board certified specialist, had to have owned a practice, but they'd have to have at least enough experience, enough time under their belt to have seen that many cases over and over again. But even that time is not equal, because they say if you go through an internship program, it's a 1-year program typically, that's the equivalent of 5 years in practice, because you see so many cases. So you kind of think, okay, well, if someone's performed an internship, then maybe they are more experienced, even though they've been out of school for 1 year, than a new graduate who's been out of school for 1 year, but who went right to the workplace and did not do an internship, right? So there's variables there. So it's my job to sift through those variables and pick and choose who I think would be most likely for the position. But to answer your question, it's pattern recognition. Somebody who's seen it over and over again, who can recognize these things fairly quickly. And then you have other things. You need to have communication skills, right? You need to be able to share the information with the client without confusing them. You need to use layperson's terms. Can't get all medical on them. I mean, there's other nuances, right? It's not for everybody. But the main thing is pattern recognition that you're looking for.
So one thing that I actually got fascinated as I started learning more and more about this, and this idea of potentially decentralizing the brick and mortar to some degree, is as I was talking to more and more veterinarians, I kind of kept hearing like recurring things that like if there was data that we could kind of get automatically, it would really help in this kind of remote diagnostic, like things like water and food intake, the dog's gait, seizure rates, those sorts of things. Are there any tools that are available right now that kind of help us gather these data points that would make it easier to recognize these patterns in kind of a remote diagnostic?
So if you're looking for what we would consider telemonitoring, right? Maybe telediagnostics, however you want to, basically the acquisition of objective data at a location that is distant from the veterinarian or the doctor, right? That's how we're going to define that. You can label that as something as simple as the actual pet owner counting respiration rates, getting a thermometer and getting a temperature on that pet, right? Weighing the pet. That's all objective. Those are numbers, objective data, right? That's fairly rudimentary, but hugely valuable if that's all you have. Then you can go to the level of, there are companies doing this now in various forms, where they monitor things like pulse oximetry, electrocardiogram, respiration rate, heart rate, And so now that's going into to the field as well. So a lot of those companies are focusing on hospital telemonitoring. So it's a patient of the hospital, you put the monitor on the pad or give it to the client or whatever it is, they go home with the device that tracks the data, usually in like a cloud-based system or an app or whatever, and then the patient comes back the following day and the vet's job is to assess the data, right? But we're seeing now more and more where you're putting that device in the hands of the pet parent so they can monitor stuff. And so if something is going off, then it prompts them to consult with a veterinarian. There's a blood glucose monitor that again, fairly new to me, but general practitioners know this already. They attach it to the pet's neck for diabetics, and it'll monitor their glucose levels like continuously. And a vet can watch those levels as often as they want to. It's continuous. And then when the pet comes in for the recheck, you can see what their last 2 weeks were on that insulin and that dose and that frequency and make adjustments based on that. So it's already happening. It's already happening. I think what you're referring to maybe is putting the power more in the hands of the pet parents so that they can monitor this stuff and then contact the veterinarian when something seems off.
Yeah, what's interesting is you talk about this blood glucose thing. There's actually one that I want to get for myself. It's called Levels, and it monitors your blood glucose, so you can watch the food that you're eating and how it affects your insulin levels and your insulin response, right? Because we know that one of the things that induces aging and disease is too high of blood sugar, which creates inflammation and all these problems. But the problem right now in human medicine is you have to have, it's only by prescription only, which I think is totally stupid. But hopefully someday, we can all get one. But I'd be interested in tracking those things for my own health, well, not only my pet. One thing that you also talked about was this idea of communication skills, which I think is also an interesting pandemic question, because we saw a lot of hospitals that were like, I'm so happy that the pet parent is out of the exam room and I kind of just get to work with the patient, Yeah. And I think when it comes to like this idea of remote monitoring, and you are at that point, the communication becomes very important, and how you work and interact with that pet parent really becomes important because they're your eyes and ears. So can you talk a little bit about that? I mean, as many cases as you've seen, can you give some examples where things have gone? You've seen, like there's certain traits or things that work really well, and maybe some areas that doesn't work so well.
So even though I'm in the virtual space, I like to make sure I'm still on the floor on occasion. So I occasionally go to hospitals and see how things are operating. I'll take on emergency shifts. I'll go in there and do surgeries because I want to see how things are going. I don't want to be out of touch. I'm virtual all the time, right? And so I do see this trend where the staff is very happy to not have clients in the building. They can wear whatever they want. They can speak how they want to speak, right? It doesn't matter anymore. You don't have to worry about all the, being politically correct or whatever, right? You can just operate with your fellow colleagues in that space. So sure, I see that. What's interesting about the veterinary field is that we are a combination of medical service and also like customer service, right? We're like a combination of a medical doctor and a hotel. Everybody wants to come to the veterinary clinic, get their medical expertise, get their medical care taken care of, but also bedside manners, good fair pricing, good care, customer service, right? So they want both worlds, which is great and sucks at the same time. Because if you want to focus on the medicine, but something goes wrong from the client's perspective, the client-facing portion, let's say the receptionist was having a bad day that day and had a bit of an attitude. Now that client, despite having great medical care, happy with the finances, now they're annoyed because the person gave them some supposed attitude on checkout, right? That sucks. We have to balance this. And veterinary staff members in general tend not to be that fancy of people, right? We're working with animals for a reason. We kind of like animals. And so we have to work with people, though, as kind of a side thing. So it's hard combining those two worlds. And both worlds get muddied up by each other, Customer service gets muddied up by medical because unfortunate things happen to pets, medically speaking, despite your best efforts, despite what you thought was going to happen. And medical stuff is so important. And to inject that with customer service stuff kind of muddies the water. So there's always an internal battle there. Having said that, it being what it is, the face-to-face stuff, and again, maybe I'm a bit old school saying this, the face-to-face interaction between a veterinarian or a CSR or a vet technician with the client is very, very important. It just is. There's verbal and nonverbal language, right? I mean, you can talk on the phone to somebody and your impression of them is one way, and then when you meet them in person and say the same exact thing in person, they have a totally different view of you. Good or bad, but it's a different view of you. The verbal and nonverbal are very important. So I'm more on the fan of let's get the clients back in the building and get that face to face. If you look at it from a sales perspective, as a board certified surgeon, my treatments of pets are not cheap, right? You're talking about chest surgery and spine surgery. These are expensive modalities. So do I really expect a client to say, sure, where do I sign on a $10,000 estimate just over the phone without meeting me in person and seeing me and seeing my expressions and my hand motions, my body language? Yeah, it's a tough sell. I mean, you could do it. Obviously, we've been doing it since the pandemic, but boy, it's a tough sell. You lose something with that. So that's my perspective on that. But I see the pros and cons of it, and there's no right answer for it. But that's how I see it. Yeah.
So do you have any examples where you've seen as you've gone through this hiring process where it seems like, I mean, is that a skill that you're looking for? Is that certain emotional intelligence skill that you're looking for when hiring doctors? Are they good people, right? I think I can't remember what conference I was at, but I was talking to another DVM, and he talked about this idea of we're comfortable, relaxed. He's like, you can always tell who the DVMs are. He's like, look for the they'll be wearing the cargo pants and the tennis shoes, right? Because they're comfortable and practical, right? They can carry all their stuff. And I just thought it was funny, and you also mentioned that, right? This idea of kind of being relaxed. That's why we're animals. So is there a certain skill set within a vet that you look for, or even, and maybe you can even touch on this too a little bit, so it's kind of maybe a two-part question, this idea of also leveraging the vet tech in a remote working environment? What would that look like, right? Because there are a lot of things that a vet tech can do, and there are certain things that a vet tech can't do. So what's this certain kind of emotional skill set that we need to be successful at kind of working and kind of treating patients remotely? And is there a way to also reduce the load on the associates by giving the vet techs involved and allowing them some maybe better work-life balance by doing some stuff from home?
So the same level of experience that I want from my doctors coincides with the level of communication. You assume that as somebody goes into this field and is there for a longer and longer period of time, they're going to learn the ins and outs of good communication, how to problem solve, how to handle conflict, how to handle the upset pet owner, how to handle an unexpected bad outcome with a pet, with a case. So that kind of has to come with the territory. It's presumed if you're experienced, that comes with your experience. Having said that, you can be a great doctor all day long, but your communication skills, your personality type just isn't great. And you've gotten along this far in your career with many, many years of experience because you're a great doctor and your clients sort of know, well, he or she is that way, but they're great doctors. And so they kind of accept that, right? From a virtual standpoint, that won't work as well because they're meeting you for the first time. They don't know you. They assume you're a doctor. They assume you're competent. And then the rest is just your bedside manners. How thorough are you? How do you communicate? Are you fairly conscientious? Are you fairly open? Do you allow for dialogue, etc.? The best thing about what I do is that I don't have to monitor my doctors, right? I trust that I hired them for a reason, so I trust them. They're going to do the job that I'm asking them to do. At the same time, the client will always give you feedback. And if it's bad feedback, they will not be shy about bad feedback. And if that bad feedback happens, well, then you look at the individual situation, figure out, was it a one-time deal? Was that doctor having a bad day? Is the client lying to me? If it happens again and again with the same person, right? There's a common trend there. Well, then there's a problem. So at the end of the day, I can do my best to try and prejudge a veterinarian at the interview and based on their resume or their CV, but I could be wrong in terms of how they actually talk to clients, what their bedside manners are like. But the clients will tell me the truth. It'll eventually come out, right? And it's the same thing in brick and mortar. It's the same thing. It's just that the turnover rate in brick and mortar for a high-paid staff member, it's a huge cost financially to realize 3 months later, boy, this person just does not communicate well with clients. Really good doctor experience, all that stuff. Did great at the interview, not doing great with our clients. That turnover is going to cost you probably $100,000 to $200,000 just to replace them, because they're higher paid, right? So it's a bigger risk for them. Whereas me, it's not as big of a financial take. They have to just be really, really good. Otherwise, I'd have to have a talk with them and fix that. The second part of your question, the vet tech. So vet techs are interesting because they are in the profession to be hands-on. That's what they want. They want to take care of pets. Okay, they're very passion-driven, they're very compassion-driven, they're very animal-driven. So they kind of have to be there cage side on the floor, right? That's what you want them to do. They are the ones that are running the diagnostics, collecting blood samples, running blood samples, treating the pet, doing all the things, right? They're vital. I mean, they're vital to the profession. But we've seen veterinary technicians go from long-term staff members, 10, 20 plus years in one practice, to now every 6 months there are new faces in the practice, right? The turnover is so crazy. And there's many reasons for that. Some is probably the caliber of folks we're hiring. Some of it is in training. Some of it is the work culture. Some of it is the workload, which contributes to culture. So the question is then, well, can you have a remote version of that? And the answer is yes and no. Depends on your practice. If you have a practice where a technician is very valuable to you, they've been there for a long time, they're a great team player, they're great with animals, but the 4 days a week is burning them out and you see it, and you might lose them. Well, can you make 2 of their days remote and figure out how they can operate remotely, right? So how can they operate remotely if they're hands-on? Well, they obviously wouldn't be hands-on anymore if they're remote, but they're still veterinary technicians. They're still super intelligent, super experienced, great work ethic. They know that hospital well, right? Because this is a senior staff member that you don't want to lose. Well, they can give inpatient updates. How's Fluffy doing? The client's calling in. How's Fluffy doing? Are the x-rays done yet? Are there any blood results yet? They can provide function almost similar to like a physician's assistant. They're not a doctor, but they're not a low-level medical person. They're right in between there, where they're an extension of the doctor now, and they're working remotely, so it's all conversational work. Well, they can help the client check in. They can check in with clients. They can do things that are beyond the capability of a CSR or a CCR, whatever you want to call them, and above the ability of a veterinary assistant, but not quite worth the time of the doctor, because the doctor is seeing cases, doing surgery, all that stuff. So you can have them work remotely and perform those functions. They're not cage side, but how much do you care about the mental health of that person? It should be a lot, right? And if you're trying to improve the culture and you're trying to retain these experienced technicians that are really valuable to your practice, well, then figure out a way to work within their confines. Also, on top of that, we're in a very female-dominated field. You have single moms that are technicians. So they're working these crazy hours and commuting to work. Well, they have to deal with like daycare and a commute and traffic and gas prices and all this stuff, right? Any single parent, it doesn't matter. But this field in particular is very female oriented. Well, so they have a child that relies on them, and they're commuting to work all the time and spending money on daycare and gas, and getting to work and working their butts off, and then coming home exhausted with a kid who now wants them. Remote work. Find a way to make their 4 or 5 days there at the clinic partially remote. They can save a ton of money, have a better quality of life, be with their child, refresh, and then when they're in the brick and mortar, they are all there, ready to tackle the busy day. So there's ways you can do it. It just depends on kind of like where your focus is on and how you want to leverage them, Yeah.
So I saw there's a corporate group that that's actually has interesting solutions, I think, to some of these problems. One is that they were implementing childcare, right, so that they could for some of their staff members, which I think is huge, because if we have credentialed veterinary technicians that spent $40,000 or $50,000 to go to school, and then they're making $15 an hour, I mean, like childcare is expensive. Like I don't have any kids, but I can't imagine those costs, right? So that's like almost an immediate raise, right? And then also, not having to commute. If you work in an inner city, like parking, that sort of stuff, like that can also be, or even if you're taking public transit, you're having to pay for that. So some of those days not having to have those expenses, again, that's a raise in some regards, because you don't have, you're not incurring those expenses. So I think there are a lot of, and then I think, you're talking about this idea of, giving updates, client updates, that sort of thing. I think with tools that are available that we see, with like IM chat groups, that sort of stuff that you can leverage, you can be communicating with the staff at the hospital, like, hey, I'm about to do the callbacks for Fluffy. can you let me know how the dental went? I see in the record everything looks good. Is there anything you want me to tell them? And pick up the phone from there, right? With like VoIP and stuff like that, they can literally just either use their computer or like actually have a physical phone at home that seems like it's part of the same network, right? So I think there are some tools we can leverage to actually make this happen. But it seems that there appears to be some sort of a mental barrier where it seems it's kind of like few and far between the hospitals that are actually thinking about this. And I see it on the corporate side of things. We're seeing some corporate groups that are thinking about taking the calls, all the calls that come into the hospital are no longer coming into the receptionist. The receptionist's job is just to take care of people, check them out, make sure that whole experience is good. Don't worry about a single phone call. And then they're actually like at the call center level, it's vet techs that are getting paid a decent amount of money to handle calls from all sorts of different hospitals, and again, because vet techs can educate, right? So if somebody's calling in and asking about like a bandage, like, hey, we were just at the hospital and the bandage seems to be jacked up, they can educate, they just can't diagnose, right? Or prescribe, right? Diagnose, prescribe, there's that short list. So I feel that there's a lot of things that can leverage this. Do you have any hospitals? I mean, I think hospitals that like want to work with you and are thinking about these things are already thinking outside the box. Have you seen personally, like when you get back into these hospitals, just an overall difference from hospitals that maybe you've worked in where they aren't kind of thinking out the box and kind of moving with times?
Yeah, absolutely. The ones that partner with Vet Triage, those, it not only helps their overall workflow, but their staff members look at the management team like, wow, they're really progressive. Like they're using these new technologies, new services to help pet parents and also make our lives easier on a daily basis. That's fantastic. Like, it looks cool, right? It's great. Especially with telemedicine being so hot since the pandemic. So yeah, there's definitely a perception there. There are hospitals that'll utilize their technicians as a teletriage service. So not quite the caliber of Vet Triage, but over the phone have medical personnel triage patients by the phone to figure out is this an emergency or not. If it is, get them in. Not an emergency, do A, B, and C for monitoring or what have you until we can fit you in, until your a family veterinarian can fit you in as an appointment. So there are facilities that are utilizing that. It's a great idea to have a call center like that. My only concern with that sort of thing is, in order for you as a technician or a CSR or a CCR to be able to adequately figure out how the day is going on the floor in real time, is to really know the inner workings of that hospital. You have to know how it operates. So a call center that's fielding calls from any which hospital coming in is a concern of mine, because they're not going to know how every hospital operates, right?
Right.
So there's going to be a deficit there. It's still useful. It's still, you can perform teletriage, but you can't tell hospital ABC if they can fit in that emergency that day or not, because you don't know how they operate. You don't know how big or small they are. You don't know what they have, what their day's laid out like. Do they do surgeries in the morning or the afternoon? Do they do diagnostics at a certain time? When's their lunch break? You have no idea who called out sick that day, all that, right? So it would be more beneficial, I would say, to have a much more narrow spectrum where the credentials for a veterinary staff member to work remotely, whether it's a technician who's medically trained or a non-medically trained person like a receptionist, CSR, CCR, to A, have been in that practice for X number of weeks, months, years, whatever your criteria might be, so that they are experienced. B, they're trustworthy, so they can work from home and without oversight, you know that they're doing what they're supposed to do. And then C, they really have a good knowledge base for the inner workings of that facility. Then when they communicate with the staff, hey, Fluffy's owner is calling, where are the x-rays, how you guys doing, can you see this walk-in today? They have an idea, they can visualize what is going on in that hospital because they've worked there for so many weeks, months, years, whatever it is. They know how it operates. If they know certain staff members are there that day, they're a bit stronger, right? I'll say, okay, well, Shelly's on that case. She's got it. She'll probably done an x-rays in 10 minutes. I'll call Fluffy Smith and say, hey, expect a call from the doctor in an hour, right? Or another shift where they're maybe not as strong, maybe they're a bit newer staff members. Okay, well, Kevin is working on that case right now with Mark. They're a bit new. I'll tell Fluffy Smith, give us 3 or 4 hours and you'll get a call back, right? Those are nuances that really matter. And so you can't have that level of nuance with a general call center that's got calls from everywhere. But if you really have a person that you trust, they're experienced, they know how that hospital works, and they're taking calls for that hospital, that's a really cool, that's one of the huge pros to doing this remote work. This decentralization is one of the huge pros of this.
Interesting. Yeah, and that's an interesting point that I actually had never thought about, right? Is understanding like each hospital's kind of business model is slightly different. So there's probably a case to be made in the sense that in some regards, if you're thinking about leveraging this, leveraging some of your own staff for some of these things rather than, because they understand the workflow of the hospital, right? They understand if that emergency can come in and how that would work. Well, as we come down to the end here, and thank you to everybody who showed up, and I think it'll be recorded so people can view it afterwards. Is there anything else, as we kind of wrap up this idea of decentralizing the hospital that you feel is really important, or any trends you're seeing in the industry as a whole that, we should be aware of?
Veterinary staff members are known for being workhorses. We're diligent, right? And oftentimes we are working harder and we're not working smarter. I talk to many practice owners and hospital managers on a daily basis. And one of the biggest faults I see is they don't take the time to establish what problems we have and how can we fix this without losing revenue, so we can still pay our staff members, but increasing access to care, making this job bearable. Not just bearable, but enjoyable, like really enjoyable, right? And so they don't take enough time to figure out how to work smarter and not harder. So I would say if I could leave with one thing, whether it's decentralization, remote work, or vet triage, or anything else, it's worth sitting down with your team and figuring out ways, creative solutions to fix the problems you have. It's worth that time. If you have to shut down the hospital for one day and lose $40,000 in revenue, it sounds like a lot of money and a big deal. It might be worth it just to have like a big brain session for how to figure out creative ways to these problems. So I would urge practice managers, practice owners to think of ways to work smarter and not as hard.
Awesome. Well, thank you, sir. It was so many things that I hadn't thought about, especially that last piece there, like not knowing the nuance of the hospital, I think is really valuable. And I had never really thought about that before. So I think it's a unique perspective to consider as we consider these things. Yeah. Kelly, do you have any questions or anything that you'd like to say before we wrap up here?
No, it's been actually a delight just to listen to you two. I'm just going back and forth going, wow, this has been really informative. And I think really outside of some people's boxes in how they think, and also just having a moment to think, I think is also valuable, because I think there's something about we're just putting the blinders on and trying to get through the day. Like you were saying, shut down the hospital for the day, right? Like just take a collective breath. Let's just stop. Let's regroup, because, I say this jokingly, but it's real. I wake up on Monday, I blink, it's Friday, and what happened in between? Yeah. Right. And I think that's not just a me thing. It's an everybody thing. And then before you know it, a month goes, 3 months goes, 6 months goes, and has anything changed?
If you listen,
that's a question.
If you listen to the complaints or concerns that staff members have, it's something like management doesn't listen, change doesn't happen fast enough, right? And that's exactly what we're talking about here. I don't know if I'm misquoting this example, but didn't Starbucks, God, this might be maybe 10 years ago now, wasn't there a situation where they closed down like all their facilities for like a week or something to try and readjust something on a very large scale? Does anybody recall that? I can't remember the details. It's worth, I want to see if I can find that, and maybe we can share it with folks. It's worth looking into something like that, because when you have large companies doing things like that, where they shut down all their services to figure things out, and they come back bigger and stronger than before, it's well worth that financial sacrifice that day to do that, to figure this out. So I think it's worth to sit down and breathe and realign things. Yeah.
I use financial sacrifice, but I think in my world and in my day and age and everything I'm looking at, what's your currency? Financial is just one currency you're working with. Time, well-being, mental health, all the things you've already mentioned through this speech, right? Those are intangible currencies, but argumentatively, maybe even more substantial than the bottom line, right? You need the bottom line. I'm not saying that, right? But in the past, we've only more looked at the bottom line instead of the other options. And now I'm like, yeah, no,
I agree.
Right.
And even those things that are more difficult to objectively measure, like mental health. Well, if you look at how much money and time does it take for turnover, right? How much money and time does it take to handle negative online reviews? How much time does it take and money that it takes to handle mishaps in the hospital, medical mishaps because you were tired or rushed, right? You can quantify those things. If you really kept track, you can quantify, and that will just give you some sort of rudimentary measure, maybe indirectly, but of your hospital's mental health. And if you could fix the mental health, the work culture, and eliminate and decrease or eliminate these other expenses, I mean, it turns into money regardless. You know, if that's what if you want something objective to measure. But yeah, I agree. I mean, this day and age, especially, what vet hospital is starving? They have more than enough work to do. Focus on your staff, on the mental health of your staff and the work culture. You've got to be in it for the long haul.
Right, and make careers, not jobs.
Right.
I think that's an interesting point, actually, for both of you, because Kelly, you being on the marketing side, like, how hard is it to bury a bad review, right? So if somebody can't get access to care, right, and if they had thought about this outside the box thinking, it's like, well, we can't get you in the hospital, but actually you can have a call with one of our doctors who's at home taking calls for this kind of stuff, So I think that's an interesting point. How hard is it to to bury a bad review from a marketing perspective? And how easy would it potentially be to solve some of those problems by essentially leveraging kind of this like decentralized workforce, right? Like people outside who can handle some, like these 82% of calls that could be handled, right? That could potentially get rid of this bad situation.
And Clint, I've been telling people this because there's this myth right now in the workplace that marketing only means new clients. New clients are just a very small part of your marketing. Everything we've been discussing today, client communication is marketing, period, end of story. Because that's the goodwill, that's how people leave the taste. If you're the person who says, your dog ate a little bit of chocolate, they're going to be fine. You just stayed, because my dog does this, so I know this one. It's going to be fine, right? Versus he ate a piece of raisin toast. You need to pick up and go in right now, right? Like handling those emotions, where I see some hospitals in the marketing sense come off the rails is they haven't managed their communications well, and they have left a void. And unfortunately, in the United States and Canada, where we work, we replace that void with the worst case scenario, which is negative. Not, I have yet to see somebody fill it with the positive. So having somebody to be there, answer the needs right away, just de-escalates the situation, which just brings positivity and empowerment down the road for like everything we discussed today. So I think this is really great conversations. I think it really opens the door to having more conversations about this. And I think now, too, even more importantly, like in VetPartners at the last meeting and physically and presently, and some of the ones socials we're going to be doing coming up, is we're at the juncture in life where we need to think out of the box to adjust to our new environment, or our environment's going to whack us hard. I mean,
yep, exactly.
Right?
Yep. Well, again, thank you, everybody. Thank you, Kelly. Thank you, VetPartners. Thank you, Dr. Rafid. I hope I get to see you again. I mean, I just saw you a couple weeks ago, but hopefully we get to see each other again in person.
Absolutely.
It was such a delight. So any other final questions before we wrap up here and let Shadi here get back to doing far more important things?
I do not see any on my end.
I don't either. Awesome. Well, thank you, everybody. It's such a pleasure. And and I'm assuming we'll get a recording that we can kind of share around for people to view this post. So
Yep.
Awesome.
Yep. That's the plan.
Awesome. Well, thank you, everybody. Thanks for spending the evening with us, or I guess early afternoon if you're in the Mountain Standard Time and Pacific Time, like Dr. Rakich is. But yeah, thank you, everybody. Have a great day.